Welcome to the Dynamic Radiologist Podcast, where we feature leading experts in healthcare. And now, here's your host, Dr. Stephen Brownstein.
Dr. Stephen Brownstein here, host of the Dynamic Radiologist Podcast, where I feature top leaders in the health field and what they are doing to change the world. Past guests and organizations I've worked with include Rutgers, New Jersey Medical School, Newark Beth Israel Medical Center, and many more. I have Dr. Jeremy Weiss here, who has done thousands of interviews with successful leaders and health professionals. We have flipped the script, and he will be interviewing me today.
Thanks, Dr. Brownstein. I appreciate it. And I'm excited because, we're going to talk about a couple topics which are dear to your heart, obviously, all things imaging. But, we're talking about the spinal kinetics. And for people who don't know, quick intro, if you don't know Dr. Brownstein, he owns and operates, dynamic medical imaging. He started, over 16 years ago in New Jersey. So they have people from all over New Jersey, doctors referring even their family members to their clinics. He's been a board certified radiologist for over 40 years. You could check him out at dynamicmedicalimaging.com. But he also started a company to scratch his own itch and to meet the need so he can better serve patients and doctors. And really, if you go check out the spinalkinetics.com, they developed the technology. And that's what we're going to talk about. How do you even develop a new technology and go about doing that? Called CRMA, which is computerized radiographic mensuration analysis. So it basically helps assess and measure spinal ligament injury. So Dr. Brownstein, tell me a little bit about, take me back. What were you using before? What type of measurements and how are you doing things before? And then now we'll talk about how you even came up with spinal kinetics.
Well, initially, before computers, we used a ruler, believe it or not, to measure things. I remember when I was a resident, we used to do pelvimetry to determine whether a baby could be delivered vaginally or C-section. We used to measure. So measurement has been a tool radiologists have used for years. Now, bring on the computer, and back in 1970, Dr. Su at University of Colorado developed the first NIH grant to deal with chiropractors to come up with a unified way to measure one vertebra compared to the other. And that was the origin. And then as computers got better, different people developed different software. And we initially used software from another vendor, but we found that there were some problems with that software. And we actually developed our own software this is probably the third iteration of it. And we're in the process actually developing artificial intelligence application of this software. But, I was introduced to software. Originally, we had a digital motion X-ray machine, and somebody showed me what then was not CRMA, but intersegmental motion analysis study. I said, that's pretty neat, it makes sense to me, so we started using that company. And then, like I said, we decided to develop our own. But before we did, I was introduced to Dr. Kronk, who's now my CEO and Director of Education at Spinal Kinetics, and he was using the same program. So he happened to be having dinner with the gentleman that we were both using the same software from. We were introduced, and we talked over the next year or so, and Jeff had his own company. I said, Jeff, it makes sense for us to join forces, because as a chiropractor, you get too busy. Insurance companies are going to come after you like flies on meat. So our concept was he'd be assimilated, and I'd kind of like an M&M. He'd be the chalk. I'd be the protective shell, having an MD company. And we've grown over the years. Like I said, we're now developing artificial intelligence software to make the process more streamlined and help get it out to more people.
How did you develop the technology? Talk about that. Like your conversation with Dr. Kronk.
Well, again, I'm not the smartest guy in the room, and Jeff, through a developer, the same developer that developed the software that we had used prior, Jeff and him developed the first iteration of our own software. And again, it's that programmer came from another company that had programmed. So how the original concept and how you program it is beyond my level of comprehension. I understand the final product and how to tweak it to make it better and more useful for the end users. But the actual ones and zeros.
I mean, we know how to flip a switch on a light. We don't need to know all the electrical work that goes into making that happen. But what kind of cases do people refer to you for that? Like, what are you actually reading? And then what does the software actually do for you?
Well, first of all, what we do is not a radiology read. It's not an interpretation of the films. That is done either by the referring doctor or a radiologist prior to us getting the film. So we get the films, and what we're measuring is intersegmental motion, the movement of one vertebra in relationship to another, either front to back, which is called translation, or top to bottom, which is called angulation. And there's certain measurements that are considered within normal range, and then abnormal, and then severely abnormal or rateable based on the AMA guides of permanent impairment. So our main referring doctors are doctors refer to us patients that have been injured, either motor vehicle accident, slip and fall, work-related injuries, sports-related injuries. Those are the main referring sources to Spinal Kinetics.
So anyone who does those particular studies, like a stress radiograph, that's who is sending you those images?
Yes, stress radiograph, just to reiterate, are flexion extension views and a lateral projection of the patient besides neutral. And so the doctors send us the studies, and we do computer analysis of those studies to measure intersegmental motion abnormalities.
Now, some people in this process, Dr. Brownstein, so let's say there is a facility, they do stress radiographs, they would send them to you, you do the analysis, and then if they're radiologists, you'll send it back to them. If they aren't radiologists, you have a team of radiologists that you have read the studies?
Yes, we have board-certified radiologists that have licenses in all 50 states that verify the point placement and sign off on the reports.
And so, I just want to talk about some of the core team of the Spinal Kinetics. Some of the doctors, because you have some experts, you, Dr. Kronk, and some others.
Yes, well, like I mentioned, Dr. Kronk is CEO and Director of Education, and Dr. Kronk also has a JD degree. So he lectures and does webinars where doctors, chiros, attorneys, case managers, insurance companies. We've educated thousands of people along the way. And also in New Jersey, you have Dr. Puglisi, Dr. Siafi. Dr. Siafi is head of marketing. Dr. Puglisi also helps with some marketing and getting the cases ready for me to review and sign off for cases in New York and New Jersey.
Why is it so important for someone who gets into like a work-related injury or slip and fall or auto accident to get those particular types of studies done, the flexion extension stress radiographs?
Well, the importance is one on the diagnostic end to see whether there's any gross fracture or something like that. But as far as CRMA, it's important because the ligamentous injury is the leading cause of chronic pain. So unless you diagnose it and treat it, there's a good chance you're going to have chronic pain either in the neck or low back as a consequence. And There's a term called accelerated degeneration, which means that if you're injured and have spinal ligament injuries, then you're more apt to get degenerative changes and also more apt to have more severe and changes showing up sooner. So it's important to diagnose it early, one, to properly treat, and two, for the attorneys to get fair and just award, because the patient will have may have chronic symptoms related to the trauma down the road. And the cost, I think there was an estimate that it costs $8,000 to $14,000 a year for the treatment of these chronic pain conditions, and also, the opioid addiction and all that stuff. So it's extremely important. There's a book called The Burden of Musculoskeletal Injury, and the spine is one of the leading causes of symptoms related to patient visits with doctors. I think it's the first and fifth most common cause is low back pain and neck pain. So it's enormous cost to the economy and to the people, as well as the pain and suffering.
Yeah. And, Dr. Brownstein, people can check out thespinalkinetics.com. Anything else people should know about spinal kinetics that we haven't discussed?
I think, if patients are listening to this, they should ask the doctor, Doc, how are you evaluating for intersegmental motion abnormalities? And, there's a good chance the doctor will look like a deer with the headlights, because majority of doctors aren't doing this. And I think the doctors are doing disservice to the patient and to them to be able to perform to the best of their ability to get the patients well.
Got it. Yeah, that makes sense. I mean, you want to see, I think you have a quote by Einstein that you like.
Yeah, nothing happens till something moves.
Nothing happens till something moves. That's right. So we'll leave it with that. Nothing happens till something moves. Dr. Brownstein, thanks for having me.
My pleasure.
Thanks for tuning in to the Dynamic Radiologist Podcast. Make sure to click subscribe to get updates on our latest episodes.